Is left. Our next guests will be in the thick of it all tomorrow. Republican Congressman Paul Broun of Georgia and Democratic Congresswoman Allison Schwartz of Pennsylvania. Thank you both for talking to us on the eve of what will be a very, very, very busy day for you both. Thank you for coming on.
Thank you, Julie. Thank you, Julie.
Congresswoman Schwartz, I wanted to start with you. If passed, how many years of tax increases will this bill require? Republicans say 10. Democrats say that small businesses will be getting tax cuts, that they will benefit as a result in the end. What say you?
Well, the fact is that we have committed to pay for this legislation, and it's paid for half in savings and half in increases, some of those taxes on some of the healthcare industries, and some shared by the wealthiest Americans. The president's made a commitment that no one who makes under $250,000 a year in family income will pay any new taxes. That's true in this bill. And in fact, as you point out, there will be a great deal of help for small businesses with tax credits, with containing costs for the American people, with families, and being able to purchase more affordable health insurance. Really 32 million more Americans being able to have a choice in affordable insurance coverage, and greater protections for every American, and making sure that the insurance they do buy covers the kind of health care needs that they have. A very important piece of legislation for the American people.
Congressman Broun, talk to me about tax increases. Talk to me about Medicare cuts, and how many years will it pay for benefits?
Well, the Medicare cuts are $500 billion, and the simple truth is that tax increases are going to hit everybody. Every single good and service in this country are going to go up because of the tax increases on all aspects of business. In fact, the simple truth is this, too, that families making $66,000 and less will have half of the tax increases fall on their backs. So every family in this country is going to see higher costs for everything, is going to see higher taxes on most people here in America, and it's just zombie economics that the Democrats are using. In fact, they're going to give 6 years worth of benefits as an example for 10 years worth of tax increases. The benefits won't start until 2014. The tax increases, if this is passed, and I hope and pray that it does not pass, will start immediately. So it is zombie economics that they're using. It's just simply not true.
When it comes down to economics today, President Obama said that he will be reducing the deficit. Congresswoman Schwartz, in the weekly GOP radio and internet address today, House Minority Leader John Boehner took aim at the Democrats' health care bill, and he said, and I'm quoting, "Democrats in Washington chose a partisan path and a costly big government agenda. The trillion-dollar stimulus isn't working as struggling families continue to ask, where are the jobs? And taxpayers' hard-earned money is being spent so fast that $2 trillion has been added to the national debt on President Obama's watch. Now Democrats want the federal government to take over health care, which represents 1/6 of our economy." He says this isn't
right. I'm happy to answer that. I mean, absolutely. This is, it's so outrageous. Of course, Mr. Boehner knows that this is not a government takeover. He knows, in fact, that if we do nothing, and what he wants to do, and of course what Paul wants to do as well, is, and it's unfortunate, they want the status quo, which is 20, 30, 40% increases for American families, for American businesses.
Allison,
it is actually creating a situation, that is really creating an economic, we can't be as competitive with these kinds of health care costs. And, you mentioned the Recovery Act, and the fact is that as much as we hear from the Republican leadership and Republican members that this, in their opinion, hasn't worked, every economist, really to the right wing and left wing and middle of the road, has said that it would have been an economic disaster, a financial disaster in this country if we hadn't taken action. We have seen a turnaround, at least a stabilization. We're beginning to see renewed confidence in the marketplace and beginning to see those kind of investments.
Go ahead, Congressman Broun.
Julie, the truth is the same people who said that if the stimulus package was passed, that unemployment would not go above 8%, are the same people who are telling us that the deficits are going to go down over the next 10 years by $100 billion. It's just not It's just not true. In fact, I just asked the American people, I asked Allison, do you really believe this is going to happen? It's just not going to happen.
Well,
it's not true.
The independent, nonpartisan Congressional Budget Office, which sometimes we don't even like the numbers sometimes, but this time what they came back with is they said it's going to be a $1.2 trillion deficit reduction over 20 years. We need to take this action both for our federal budget, but also for the American people and for our businesses who are really struggling every day to pay the cost of health care. We are going to contain the rising cost of health care for our families, our businesses, and for government, and we're going to improve the quality. We have to take this action. The status quo is really unsustainable.
Congressman Brown, I'm going to give you the final word. I want to be fair since I started with Congresswoman Schwartz, and then I've really got to go.
Well, Julie, the cost of everybody's health insurance is going to skyrocket. In fact, the experts tell us that a family of four is going to see a $2,100 increase in their cost of insurance. So they're not lowering the cost at all. In fact, they use the zombie economics. They figure 10 years worth of huge tax increases on everybody, which is going to increase the cost of goods and services for everybody, to try to bring a deficit reduction of $100 billion, and it's just not going to happen. And in the out years, it's going to skyrocket. So they just use this zombie economics to try to prove a point, but it's just not true. It's going to be very costly. It's going to drive people away from providers because doctors are going to quit seeing patients.
Just opinions.
Seeing you two standing side by side, addressing one another without even looking at each other, this is exactly why this will not be a bipartisan bill tomorrow.
Actually, we were instructed to look at the camera. We're happy to talk to each other on the same floor. We know each other. That's not what it's about. It really is a difference. We do not agree on this piece of legislation.
The bipartisan vote is a no vote because we're going to have a number of that understand that this is costing too much. I've had a number of them who told me that they're going to vote no because it's too costly for everybody and it's too costly for government. So they're voting no too. So the bipartisan vote is no.
It is a very centrist bill, as you know, and we do have to wrap this up. Thank you.
Thank you very much, though, for coming on, Congresswoman Schwartz and Congressman Brown. Thank you very much.